Hi everyone, I'm Dr. Aravind, consultant in Reproductive Medicine. Today I shall share my views on the topic, a failed ICSI, what next? We all know that with increasing clinical expertise and advanced technology, the success rate of ICSI treatment is quite high now. It must reach around 60%. But still there are definitely some unfortunate couple who does not make it in the first or second attempt. This is a case of failed ICSI treatment, which is often distressing for the couple as well as the clinician. We shall discuss what are the reasons for a failed ICSI treatment and how to tackle it. What are the reasons for a failed ICSI or IVF treatment? There are many reasons, and in some cases we may not be able to find out a definite reasons, but it might be multifactorial. Primarily, the first and foremost reason would be the problems with the embryo quality, which is again due to the problems with the egg, the oocyte, or the sperm. There could be other causes like the problems in the ovaries like endometriosis, hormonal imbalances like PCOS, small fibroids in the uterus or in the inside of the uterus, the problems with the lining of the uterus, fluid in the tubes which we call as hydrosalpinx. These are some of the reasons for a failed ICSI treatment. Apart from this, regarding the male partner, the quality of the semen, high DNA fragmentation of the semen, undiagnosed or missed problems like varicocele of the scrotum could be the contributing factors for a failed ICSI. There are also some other factors like genetic factors like chromosomal abnormalities in either the husband or the wife, or some immune related factors like thyroid autoantibodies, which can also contribute to a failed ICSI treatment. So as I said, a failed IVF or ICSI is a distressing situation for both the couple and the doctor. But we should not lose hope, and we are at our hospital have very systematic and scientific method and algorithm to approach to such couples. What to do in case of one or two failed cases of ICSI? First of all, we need a prior systematic workup regarding any correctable conditions, which could include your lifestyle like reducing and maintaining a correct BMI, quitting junk food and unhealthy food, quitting addictions like smoking or alcohol, and occupational modifications. All this play a very important role. We may have to give some medicines to tackle your problems with the oocyte or sperm quality so that we get the best sperms and the eggs. If there are any surgical conditions identified, like which I said, fibroids, tubal problems, we may have to do corrective surgeries for them or do a procedure called hysteroscopy to see if the lining of the uterus is correct or not. In case of male problems, if there is an undiagnosed or mystic varicocele, we may have to correct that. And after that, after this correction, when you go to the ICSI treatment protocol, we may have to reevaluate the previous protocols. We may have to change the protocols, change the drug preparation, change the dose of the drug. All this will attribute to a positive outcome in the coming cycle. Also, some minor variations and very careful variations in the last final injection, the time in which we take the egg retrieval also play important role. Again, in the embryological lab, we also institute newer protocols and newer method of selecting the best sperm and the egg so that this cycle does not fail. In case of an identified genetic problems, we also have an option for testing the embryos prior to transfer, which is called as the pre-implantation genetic testing, which makes sure your embryos are genetically normal. And having made good quality euploid normal embryos, before the embryo transfer also, we have to give some newer preparation of drugs which we call as adjuvants, which could be immunoglobulins, drugs like intralipids, or sometimes in case of immune or previous miscarriages, therapies like HLT, that is husband leukocyte transfer. So if there is a scientific and systematic approach to a couple with previous 1 or 2 failed or even more failed ICSI cycles, we are optimistic that you need not be disheartened, but you can achieve your dream of having a child of your own. Thank you.